Okay, welcome everybody. My name is Carly Sage, and I am a functional integrative practitioner, and I also own Block 134 in Putnam, Connecticut. It's an arts and wellness center, and we feature multiple practitioners there in holistic practices in particular. And today I'm really proud and excited to be introducing Dr. Irene Catania. She's a naturopathic physician, a homeopathic doctor, an acupuncturist, and she is now practicing at Block 134. Welcome, Irene. How are you today?
Thank you. Very well. So first, I want to thank you for your support of my work at Block 134 and also your work as a health and energy practitioner. I know we have a shared vision of bringing truth and education to patients, and I hope that today I can help in sharing with people how they can reach their health potential.
Yes, I'm so excited about this. Really love that we're offering some resources for our community and those beyond, and just share a little bit about what we have going on there and your services in particular. Tell us something about your background as a naturopathic physician. How did you come to do this?
Yeah, so initially I studied holistic health, functional medicine, and nutritional counseling. That started in 1984. And after doing some counseling, I went on to naturopathic medical school. I graduated in 1994. I started a practice. And a few years after that, I went back to school for acupuncture and oriental medicine, another 3 years, and brought that into my practice while I was practicing full time. Before becoming a doctor, I worked in conventional medicine, both as a transcriptionist and medical assistant. And I feel that was valuable because it helped me to develop a respect for conventional medicine, as well as to see where it may have felt short.
Wow. So I want to thank you for paving the way for practitioners like myself. You've really studied all of this at the root, and that's really exciting to hear your background. But many people are unclear about what a naturopathic physician or a homeopath or an acupuncturist does. So maybe you can just give us a brief overview of that to help people understand a little better.
There's people are still confused. So that's often what I offer in my initial consult with them in education. Oftentimes, patients know that they don't want to go the route of medication for the rest of their lives with potential side effects if there's an alternative to get better. So with naturopathic medicine, we do 4 years of naturopathic medical school, 4 years of pre-med. The difference is not so much in the basic sciences, but our study of therapeutics and also our approach to health and disease. So our focus is not on symptoms to manage symptoms or manage a disease, but looking at the potential for the person to get well. So we look at some of the naturopathic principles of first do no harm. If there's an option of not having medication for the rest of your life, doctor is teacher, so we always need to educate the patient because these are often new ways of doing things, um, and looking for the underlying cause. And again, in conventional medicine, it's not a focus. Symptoms are a focus. We may use functional medicine testing to look at what's out of balance. We look at conventional testing, laboratory work, some more sophisticated studies, and our therapeutics are pretty much all the natural therapeutics you could think about. So that could include homeopathy, acupuncture, nutritional supplements, botanical medicine or herbs, physical medicine, energy medicine, um, and of course, nutrition as the foundation of health. With
Wow.
acupuncture and homeopathy, both are considered energy systems of medicine, which I understand could be a foreign concept to many patients. In and of themselves is a whole discussion. So with acupuncture, which is a complete system of medicine in China and other countries, we can address the totality of the person or any condition they may have. Often people think of it as just for pain, and I feel it exceeds many systems of medicine for resolving pain. Um, but also it can be used for almost any condition. Frequently, people would come in with digestive complaints, hormonal imbalances, anxiety, uh, and pain or conditions that their conventional medicine has not been successful with. Being an energy system of medicine, we look at the energy pathways in the body. So this is a system of medicine a couple thousand years old. In my experience studying conventional medicine, this is far more sophisticated, and you can never learn enough. Principles of hundreds of points and many pathways in the body, and then the theories of what we may use to address a particular condition. I would say in my experience, I'm often amazed at the results. I don't expect patients to come back after a couple of treatments and say they felt something different, even if it's a patient who had no knowledge of this system and was not expecting results. So it was something I wanted to add to my practice even after like 12 years of college. I knew I had to add this. In terms of homeopathy, it's another energy system of medicine where we're using dilute substances from the ant, plant, or mineral kingdom. It's again a system over 200 years old, so it's not new. And we work with the totality of the person. So that means not just looking at their physical complaints, but also looking at the mental, emotional, spiritual components and just characteristics which make someone different. So they're not good or bad. It's just what makes someone unique. And then we look at all of those key components and match it up with a remedy using generally hundreds of remedies, although there's thousands, but probably hundreds of the most common. And they would get this remedy to stimulate healing of the body. So again, it's the premise that if you give the body what it needs, often it has the capability to restore balance.
Mm. Yeah, that is so profound. And I think you and I share the same views that conventional medicine is important. We don't want to, not acknowledge that, but it really doesn't treat the chronic or ongoing conditions or the energy component of the human being. And that's really important to look at all of those different levels, and be proactive with that. And I think the education and the empowerment of the patient is really important as well. And that's something that's very distinct. So that's all really exciting, and it makes a lot of sense. I appreciate that explanation. So
Thank you. And I would address that, and that many patients you see and I see may have physical complaints, and they've gone to doctors for many years, 10 years,
right.
20 years, and they had all the physical addressed, they had all the laboratory testing done, but they're still not well. And often many of them have also been in therapy for many years. So they're addressing the psychological, emotional component. And it's hard to describe that there's other levels to our health and well-being. And
Right.
that may be more on the emotional level, which is recognized today as particularly some patients who are extremely sensitive to their environment. It's sensitive to light, to noise, to crowds, to what's going on in the world. And that's not everybody, but there's a certain population. And if that's not recognized or addressed, it could be the block that holds them back.
Mm,
And some of what we may do is releasing that energy so that all the other therapies can work,
mm.
whether it's a medication, whether it's an herb, whether it's their diet, whether it's their mindset, that there's something holding them back. And that's where I feel the energy medicine comes in, whether it's acupuncture or homeopathy or some of the work that you do with energy.
Yeah, absolutely. It really is getting to the root cause, but in such a different way than even, my clinical training has taught me. So it's all very exciting and complementary. It all works together synergistically, which is the best part. Yeah.
Yes.
So what kind of patients do you see? And you've mentioned a few things that you address, like pain and, chronic symptoms, if you will. But yeah, tell us a little bit about who you would typically see in your office.
I would say I see patients of all levels of health. So some people come in, they don't have a major complaint, but they're working on their health. They're exercising, they're eating better. They may be taking some supplements and they want to know if they're doing the right thing. And then other patients, particularly, and I see a lot of seniors, they recognize that there's more to what they're doing, more than the medications they were given, or they don't want to be on the medications. And they're looking for alternatives or to say, can you educate me? Am I doing the right diet? Am I taking the right supplements? And then I also see a lot of chronic disease. And since the start of my practice, I often worked with patients who have seen many doctors or many specialists, and they were stuck. So it could be a skin condition, and I'd always have to ask if they saw a specialist, to make sure they were getting the care they needed. And they may say, yes, I've seen 6 of them.
Hmm.
Okay, then you can come in my door because I know you've had the workup, you've had the education on medications, what your options are, and now we can look at it differently and maybe look at it from a holistic point of view and look at allergies or the gut microbiome or stress or infections or all of those things that contribute to a skin problem.
Hmm.
I've worked a lot with neurodegenerative diseases, so that has included ALS or Lou Gehrig's disease, multiple sclerosis, Parkinson's disease, and I'm not saying that, okay, I have the answer, I can cure those diseases. Of course not. But using principles of natural medicine and functional medicine and what we understand from conventional medicine and what's going on, we can often help that patient improve. So I'm not saying
Hmm.
the condition goes away, but we can optimize their condition many times in ways that conventional medicine is just suppressing their symptoms. But even in conventional medicine, we may know certain things are going on. We may know certain neurotransmitters are out of balance. But conventional medicine doesn't know how to correct that, even though it's in the literature, in their literature. And those are the things that we can work with natural supplements.
Right.
And there may be some drugs that address it. I'm not saying there isn't, but often those drugs can either make the patient better or worse. And with naturopathic medicine, it's first do no harm. I don't want to take the risk of making someone worse. Another thing that I feel we excel with is hormonal imbalances. So primarily women, but also men. So we know that men may have testosterone imbalances or too much female hormones, and that can lead to prostate issues or cancer. For women, we look at initially if they're having problems with their cycle, if they're having fibroids, endometriosis, fibrocystic breast, infertility problems, and then they move into menopause or postmenopause and osteoporosis and preventing heart disease. And conventional medicine looks at blood work, which only says, okay, yes, you're in menopause, which they already know that, but not looking at what is the imbalance that we could correct, because they don't have anything that can gently and naturally correct things without risks of cancer or other problems. I also work a lot with children. So I work with kids on the today who are suffering from anxiety or depression. So I would say there really isn't anything that I don't address, because naturopathic medicine as well as homeopathy, it's not disease specialty, is our therapeutics and how we address things.
Yeah. Yeah. So no matter the label that conventional medicine would typically give something, you're really looking at the underlying cause of that. And
Exactly.
yeah,
Exactly.
which I love. I love. So what could a patient expect from naturopathy? And I'm curious how important testing is in your practice.
For me, testing is very important. Interestingly, and I've worked in major hospitals throughout the country. I've worked with the residents, and even seeing my patients, I'm surprised at how much physicians do not understand blood testing. They know if you have a disease, they know if you have diabetes, but if you're 1/10 of a point away from diabetes, it's not addressed, or they may say, oh, you have a little sugar. And if the patient doesn't follow up for 2 years, then they've got the problem. So when a patient comes to see me, I think the most important thing is getting the story right the first time. So when they come in, usually I don't cut them off. We have an hour and a half, sometimes 2 hours to get their history. I'll
Mm,
look at all their previous blood labs because the history is important. If I see something today, but you didn't have it last year, that means something. Versus if I see something today and it was creeping up over the past 10 years. So the history is very important. So we spend an hour and a half, 2 hours. I'll do a brief overview of their nutritional status and maybe make a couple of recommendations before doing a full nutritional workup. If they're on supplements, I tell them to bring in their shopping bag. I'll look at things and honestly tell them this is a good idea, this is a good idea, but not a priority, or I don't see any reason for you to take this.
mhm.
Um, I'll look at all of their other testing and then requisition blood labs. Often there's things missing from their blood labs. That is important, like especially an older person, cardiovascular risk testing. And then, of course, all the functional testing, which is looking at what may be out of balance or not serving them. And if they don't have a disease now, it can lead to that, or maybe it's contributing to a current problem. I don't throw every possible test at a person. It's very individualized. I'll explain why I'm doing it. And it's up to the patient if they want to go ahead and say, I'll do 4 tests, or let me start with 1, and I'll prioritize it. Many times it's overwhelming if we find too many things to address. So we may start with prioritizing and correcting that, and then retest in 3 months and see if we've reached our goals. But also, I will tell patients they haven't seen their doctor, something is suspicious. I think they needed an MRI. I was trained in radiology and scanning to know the importance of that.
Mm.
But also to know that if you have a headache, you don't have to get a brain scan right away. To have the balance of what's common sense.
Yeah, yeah. That's great. Very comprehensive. So thank you for all that. And just some logistical questions in case people are wondering and they're curious and might want to work with you. Like how long would someone anticipate working with you if they were to start this process? And then how often do they see you? You know, you mentioned your initial intake and what that's like, but what about follow-ups and, do you take insurance and all of that? So just some,
Okay, great
yeah.
question.
Mm.
So generally, and everybody's different, but generally I would see patients once per month, and I ask for a 6 month commitment. Keeps in mind, if we did testing, we would follow up in 3 months. If we didn't reach the goals, the protocol is changed and you follow up 3 months later. If somebody has a condition where symptoms keep changing every couple of weeks, then they may need to do an in-between visit, and it could be a briefer visit just to let me know how they're doing and how I may change the protocol. Um, if they have a chronic condition like a neurologic condition, say MS, it's not going to go away in 6 months. But after 6 months, they may be stable or have enough improvement where we may follow up every 2 months and not every month. But generally, that's very reasonable because I will change the protocol every month based upon how they feel. Are they doing a lot better? There may be things that they're testing at home, like they may be taking their own blood pressure. So I see how that's been going during the month. Or if they have thyroid, they're taking their temperatures. Or if we made nutritional changes, how well they're doing with that. But generally, it's once a month. And I can say from experience with most patients, from 1 month to the next, generally, they feel some improvement, and we can monitor that with testing.
Mm. That's great. Exciting. Yeah. Did you mention the insurance if you take that or not?
Oh, so the insurance. Currently, um, I'm in a number of networks. Um, but with each network, there could be 10, 15. Make sure, confirm that I am in the network. And then I'd be happy to work with their insurance.
That's great. Good to know. So if somebody wants to book an appointment with you, how do they contact you to do so?
So they can contact me. Right now I'm on healthprofs.com, and that will give more of an overview as well as contact information. They can contact me by phone or email, and I'll get back to them. And then I would schedule, as I've done for 25 years, a free consult by phone or video so that I can hear more about their current concerns and give them an overview of how I may address it, especially for some people who they never heard of a naturopath, they've only had conventional care. It's a no pressure consult. I don't want them to schedule at the end. I want them to think about it because this is a commitment.
Yeah. Yeah. It is an investment in your health. Yeah. What is better than that? But absolutely. That's great to know. So, yes, folks, you can contact Dr. Catania. You can also go to block134.com where she and other health practitioners at Block 134 are listed in our directory. And we will be doing more of these educational videos and look for some upcoming in-person and online workshops and webinars too. We're really looking to put some content out there, some information for you all, and be a hub of really amazing resources for the community. So thank you for joining us today, and we will talk soon.
Thank you, Carly. And I look forward to doing more at Block 134. And we've talked about upcoming talks or workshops. So really looking forward to that. Thank
Yeah,
you.
it's all exciting. Thanks. Okay, talk soon.